Good evening, everybody. Dr. Bhanote is here with us. My name is Irina Koifman. We are about to start a wonderful presentation for you titled Rest, Recovery, and Sleep Health for the Sarcoidosis patients. I just wanted to give a few more seconds for people to joining, and then we'll go right into the next slide in maybe 30 seconds, Dr. Bhanote. Welcome, everybody. Wonderful. So before the presentation, I just wanted to bring a little bit of our history and who we are, why we exist, and why we're doing these webinars. I'm a board member of Life and Breath Foundation, which is a nonprofit foundation that was founded by Sean Hall, who lost his mother to sarcoidosis very suddenly. And family did not, I think, realized or were not told really about sarcoidosis. And then his mom had the disease and was battling it. So after her sudden passing, Sean went on a quest to help people like him and patients to really understand what sarcoidosis is, to help them bring more information, not only to the patient caregivers, but to medical communities. And really found this fantastic nonprofit organization. All of the board members, we all volunteer, and we volunteer our time to help patients and family members and communities get better. Our primary goals are to offer sarcoidosis community effective tools to track their journey and despite medical issues and maximize their quality of life, to provide a nurturing environment for those affected by sarcoidosis to share their experience, and to build more awareness within the medical community to help combat this chronic disease. My name is Irina Koifman. I am a nurse practitioner, doctor of nursing practice, and again, very proud member of Life and Breath Foundation. With me today is Dr. Monisha Bhanote. He is founder and CEO of Holistic Wellbeing Collective. She's not once, twice, or even 3 times, but quadruple certified physician. And I can tell you this is huge. She has expertise in integrative medicine, anatomic and clinical pathology, psychopathology, breast, bone, and soft tissue cancer, and functional medicine. And what I think really stands Dr. Bhanote apart from everybody else that I know, and I know a lot of physicians that also are very active in functional medicine and they like lifestyle medicine, but she is certified culinary medicine specialist. And this is a topic on its own, and we'll talk to Dr. Bhanote later about that and a little bit more about what she'll bring next. But I'm very proud and happy and honored to present to you Dr. Bhanote, who will be presenting tonight. Dr. Bhanote, take it away.
Thank you so much, Irina, for that warm introduction, and for Life and Breath for having me back once again to present rest, recovery, and sleep health for the sarcoidosis patient. So I also happen to be a member of the clinical advisory board for Life and Breath Foundation. So they are really doing an amazing job to bring all this information to the community and really to help these patients in so many ways. So I'm going to spend the evening with you talking to you about the importance of sleep. I am going to, just so you can really focus on the presentation, I'm going to take my camera off because it's more important for you to learn the things that I'm going to tell you. So we are going to break this conversation down into, let's see if it will work, but so just so you know where we're coming to, we are doing a breakdown of when should you be paying attention and when should you not. So if you are a science geek like me, the science behind sleep is going to be totally fascinating to you. If you're kind of like, well, I wake up, I sleep, I dream, I don't dream, then the stages of sleep will be interesting to you. Obviously, everybody wants to know what's the relationship between sleep and sarcoidosis and the research out there. So that will be the next thing. And then really what we want to get to is what are the suggestions for better sleep? And then at the end, we will address your Q&A. I know we've had a number of questions come in. So we are looking forward to helping you out and answering those. So why is sleep so important? Well, besides the fact that this dog is super, super cute, and you will see very entertaining dog pictures because I am an animal lover, but really sleep is an essential function. We can't function without sleep. It's necessary in order for our body and our mind to recharge. It also is important because it wards off diseases. Essentially, you want to think of sleep as a housekeeper. And what it is a housekeeper of our brain. It actually removes toxins that build up while we're awake when we sleep. So when we're sleeping, our body doesn't stop working. It's actually even working harder because it's removing all the stuff from throughout the day. So when we don't get enough sleep, the brain cannot function properly. And this, as you may have experienced at some point in your life, can impair your ability to concentrate, to think clearly, to remember things. And really, just about for everybody, it has profound consequences on thinking, our emotional state, and our physical health. So how does sleep work exactly? Well, sleep does affect every tissue and every system in our body, from our brain to our heart to our metabolism and our immune system. It has a critical role in supporting our general health. Having a positive mood. So good sleep equals positive mood. Bad sleep, well, you know how cranky we can be after we have a bad night's sleep. Also, sleep is helpful for improving your immunity, maintaining a healthy weight, learning and memory, creativity, and even how we look in the morning. So if you think about it, when you don't get a good night's sleep, those under eye circles, those bags under our eyes, they show up pretty quickly, right? So research has shown that chronic lack of sleep or poor quality sleep increases the risk of a number of chronic diseases, some of them being high blood pressure, cardiovascular disease, diabetes, depression, and of course, obesity. I'm just seeing, okay, just seeing that there's a little QA going on. So I'm gonna close that so I don't get distracted with that, but Irina will be monitoring the Q&A and we will definitely get to all your questions. So today there actually exists a substantial body of literature that demonstrates that sleep plays a unique and critical role in healing and repairing both the mind and body. So when we are talking about sarcoidosis and we're talking about our health and how we are going to repair our health issues, sleep is a conversation that needs to be had with your physician. We need to know how well you're sleeping, what's causing sleep issues, and making sure we're really setting ourselves up for optimal sleep. So that's where having an integrative approach is, beneficial, because that's going to improve health and well-being by optimizing the power of sleep. And the key elements when we're thinking about optimal sleep is sleep timing, sleep duration, and sleep quality. So it is not just about, okay, I fell asleep and I had some sleep. It's the amount of sleep you have and the quality, because we really want to have restorative optimal sleep. Let's see, my slide is not moving. Okay, so now let's get to the science behind sleep. So this is where all you science geeks want to wake up for a second, because it's pretty cool how sleep works. If you have heard the terminology sympathetic and parasympathetic, where sympathetic is that flight and fight response where your body is in a overstressed state and constantly releasing cortisol, well, think of sleep as your ultimate parasympathetic activity, if you can get quality sleep. Sleep is basically 8 hours of deep breathing and meditation. So think of sleep in a broader sense of what it's doing to your body. It's putting it into a relaxation state. Now, under normal conditions, sleep physiology will balance your hormone levels. It will control metabolism, lower blood pressure, boost your immune system, which we all need right now. It will also repair your DNA. And as we age, our DNA mutations and damage that happens over time is what leads to a number of diseases and cancers and stuff. So we want to have that sleep so our body is repairing. And it also allows us to recover from psychological trauma. So when we think about sleep, there's actual stages that are happening. So there are 4 stages of sleep. So once we fall asleep, our body goes into a sleep cycle. The first of these 3 stages are known as non-rapid eye movement. So, and then the final stage is known as REM, or rapid eye movement. Now, if you look at the image on the top right, you can see that we actually cycle through these 4 stages multiple times in a night. Ideally, when we are having good quality and efficient sleep, we cycle through them about 5 times in a night. So each of these cycles will last approximately 90 to 120 minutes, with most of our sleep actually in the stage 2. Now, adult sleep, so when we go to sleep, usually it is best that we fall asleep in under 20 minutes. That is good for sleep efficiency. And we want to have, everybody's amount of sleep that their body requires will be different. So there's nothing set in stone of how many hours you need, but in average, people do very well between 7 and 9 hours. Now, if you're falling asleep in less than 5 minutes, you're kind of overtired, which means you really need to evaluate what you're doing throughout your day. You want it, that prime period is between that 5 to 20 minutes when you hit your pillow, when you hit your bed and you fall asleep. So just keep that in mind, how quickly you're falling asleep. And we can talk about how you can actually measure that and keep track of that. But when we look at the different stages of sleep, so stage 1 only lasts for a few minutes, less than 5 minutes. And this is that light transitional sleep. It's actually the first stage, and it goes between wakefulness and sleep, and it's very light sleep. This is the point where in your body, your muscles start relaxing, your heart rate, breathing, and eye movements begin to slow. And then we move on in that, after that few minutes, right into stage 2 of sleep. Now, stage 2 of sleep is definitely more of a deeper sleep, but where the heart rate and breathing continue to slow down. The muscles become even more relaxed, but now this is where your core body temperature also decreases and your brain waves slow down. And this is more stable sleep. So this is when somebody's in stage 2 sleep, it's really hard to be woken up from this stage. And this is the one that lasts the longest of each of the stages, about 50% of that cycle. Now, then we go on to stage 3. Now, stage 3 is very important because this is a stage we want to get to make you feel refreshed and alert the next day. So you might say, okay, I went to sleep, I only slept for a couple hours, or I went to sleep and I had my 8 hours, but I don't feel refreshed. So looking at how much of each stage you're getting and where you're getting this could be helpful to determine what are some factors. Now, in stage 3, the heart rate, breathing, brain wave activity reach their lowest levels of the night. And this is the most relaxed the muscles would be. This is your deepest stage of sleep. And in this stage, hormones such as growth hormone are increased, and that a growth hormone is important for muscle and bone repair. And then this is also critical because this is where that restorative sleep allows the body to recover and grow and boost the immune system. So stage 3 is just as important as any of the other stages. Now, stage 4, many people can think of when they're thinking that they're dreaming, right? So most, but not all dreams happen in stage 4 sleep. the REM stage. And in that stage, what's happening is the muscles become paralyzed, you start dreaming, and the eyes start moving rapidly. There's an increased heart rate. There's elevated brain activity, almost to a state of being like awake. But because you have this muscle paralysis, it stops you from physically acting out those dreams that you're actually having, even though they might seem super vivid. And the duration of each REM sleep cycle actually increases as the night progresses. So in the beginning of the night, you'll have a shorter REM, but then towards the end of the night, you'll have a longer REM. That's why we tend to, as we're waking up, remember that most recent dream as opposed to ones that happened earlier in the night, because it's a longer stage and towards the end. Now, numerous studies have also linked REM sleep to memory consolidation. So this is where, you know, I tell a lot of people, especially students, when they're studying, that the ones who are pulling all-nighters for, you know, their exams and they're learning all this new material, but then they don't sleep. Well, you need to get to that REM stage to consolidate what you learned in the day, what you know, and then these experiences become those long-term memories. Do keep in mind that the duration of REM sleep, this stage, will decrease as you age. Now, when it comes to sarcoidosis patients do have a higher, there are sleep-related disorders associated with sarcoidosis. There's actually a higher prevalence of obstructive sleep apnea with sarcoidosis patients. And those sarcoidosis patients that have obstructive sleep apnea and also have the sarcoid that involves their lung parenchyma have higher states of apnea or hypoapnea and oxygen desaturation. Sarcoidosis patients can also experience periodic limb movements and restless leg when they sleep. And sarcoidosis in itself is an independent predictor of excessive daytime sleepiness. So patients who have this, by no fault of their own, can experience excessive daytime sleepiness, which is why it's so important to make sure we have our sleep routine dialed in. And I will get to that definitely, because it's almost like having a sleep prescription. What's the best way to sleep? But what is really happening when sarcoidosis patients experience sleep disorders? Well, respiratory symptoms are associated with pulmonary sarcoidosis, as you know, the most common clinical disease manifestation. Those granulomas can lead to sleep disturbances by causing inflammation in the airways where we breathe. That's why here at the Life and Breath Foundation, we're always emphasizing practicing your breath. It's not just the breath of the day and how you're breathing normally, but really getting into a good state of breathing and having ways to open up the airways. Now, also, what happens is a number of sarcoidosis patients are on corticosteroids because that's the mainstay of treatment. So weight gain from the corticosteroids may actually induce this obstructive sleep apnea. So something to keep in mind. And then also we can have patients that have neurosarcoidosis. And in neurosarcoidosis, you can actually have a direct infiltration of these granulomas into this specific part of the brain, which is called the hypothalamus, that is involved in regulating that sleep and circadian function. Which for neurosarcoidosis patients, sleep is really quite a struggle because now it's in a place where that organ doesn't even have its full ability. So when we were looking at sleep disturbances and symptom burden in sarcoidosis patients. So the study that I came across was a study done out at the University of California, San Francisco. And what their hypothesis was that sarcoidosis patients would report more sleep disturbances than healthy controls. And they wanted to see, what was going on here? What were the actual symptoms? Was there any relationship with the type of sarcoid, the extent of sarcoid? What were we exactly seeing? So in this study, they took 84 sarcoidosis patients and 30 healthy controls, and they measured sleep disturbance, psychosocial symptoms, and quality of life, both at the enrollment of the study and longitudinally over time. And one of the ways they did this was using a general sleep disturbance scale with a questionnaire, seeing where the individuals were answering questions between having no disturbance, rare disturbance, occasional, and then frequent disturbance. So in this study, the University of California found that 54% of sarcoidosis patients reported frequent and occasional sleep disturbance compared to only 17% of the healthy controls. And those sleep disturbances most strongly correlated with other things such as fatigue, depression, cognitive dysfunction, and negatively impacted the quality of life. Now, if you think of what the function of sleep is, this makes sense for anybody who's not sleeping. You would be fatigued. You would be, mentally not at your optimal state. Now, the question is, okay, I have sarcoid, my sarcoid's not that bad, versus somebody who has, a very active form of sarcoid. How do these individuals compare? And what they found was that the traditional measures of sarcoidosis disease severity or activity was not associated with sleep disturbances. So what that means is that there was no difference with sarcoid severity or clinical disease activity, that somebody who has a worse sarcoidosis would have worse sleep disturbances. There was no difference there. There was also no difference in the sleep disturbance score for how old the patient was, the sex of the patient, whether the patient had a higher body mass index, whether the patient snored, or if the patient had blood pressure differences. And then also there was no difference noted when it came to if a sarcoid patient was using immunosuppression with prednisone, or if they were using sleep aid medication. So what this study actually brings to light to me is that yes, sarcoidosis is a contributing factor, but really having that sleep ritual, that sleep hygiene is going to be so important for the individual. No matter what stage of sarcoid you are in, you are going to have benefit from this, as opposed to just kind of throwing your hands up in the air and kind of giving up that I have sarcoid, I'm immunosuppressed, this is what's going to happen. You actually do have quite a bit of control over this. So I do want you to keep that in mind. So now, if any of you are sitting there, well, some of you might be watching this on your cell phone, so I'm going to forgive you until this talk is over. But then what I really want you to do is put your phones away, turn off the TV, and prepare for a restful night's sleep. So with that, the question is, how can I improve my sleep? So sleep is definitely one of the pillars we use at the Andrew Weil Center for Integrative Medicine and at the Institute for Functional Medicine. It is a pillar of health. So the things that I'm going to discuss with you are these approaches from both of these institutions. So one of the things that I find that many people are surprised about is alcohol. Now, we sometimes turn to alcohol because we think, all right, it makes me tired, it actually helps me sleep, but really, in reality, there's enough research and studies to show that it does not actually help you stay asleep, because what happens is it might help you go to sleep at that moment, but during the night, alcohol decreases your REM sleep. early in the night. And then when the alcohol wears off, there's this REM sleep rebound phenomenon with prolonged REM stages. Now, if you remember when I was talking about the stages of sleep, we want them to be in certain amount intervals, right? So if we're messing with that, we're already messing with our ability to recover. So you definitely want to avoid alcohol within that 3 hours of bedtime. Another thing to consider is caffeine. Now, everybody metabolizes caffeine differently. For many people, stopping caffeine at 2 p.m. will be a good amount of time. Some people are quick metabolizers and they can metabolize it in 6 hours. Some people, it actually takes them 12 hours to metabolize. That is a very individual thing. So I know a number of individuals who will tell me that they go for their coffee at 3 o'clock in the afternoon just to get through work, but then they have sleep problems. So it is something to consider, because part of that might be you still have caffeine in your body. Another thing to consider is if you do have allergies or you take something seasonally, Sudafed and decongestant medicines at night can also be stimulating and disrupt your sleep. Then also keep in mind any medications that you're on that might be contributing to sleep problems. So it's definitely worth, when you go and pick up your prescription with your pharmacist, to ask, do any of these that I'm taking contribute to sleep issues? Just to be aware, because that might require adjusting the timing of when you actually take the medication. This definitely comes into place when you're taking supplements, because I know many people who don't realize that they shouldn't take their multivitamin late at night, and then they pop it late at night and they wonder why they're wired. Well, those B vitamins are going to keep you up at night. So definitely talking to your physician and your pharmacist about this stuff is very important. And then another thing is, try and complete any aerobic exercise before 6 p.m. or at least 3 hours before bed. Now, when you do aerobic activity, you are actually increasing that sympathetic response. So then you are increasing the amount of cortisol, which is your stress hormone, coming out of your body. So we really don't want that. We actually want cortisol to be released in the morning. So there's a reason why, some people do suggest exercising in the morning. That's when our cortisol levels are the highest, and our body naturally likes that. Now, another thing to consider is nighttime tension and anxiety. Well, it's not always easy to avoid anxiety-provoking activities, but there are some to keep in mind. One of them, which is watching the news before going to bed. There's a lot of interesting things going on in the world, and there will always continue to be. That's what news does. And when they actually did research on individuals who watch news, that they have increased levels of anxiety. And anxiety, it's almost like, which one comes first? Does the anxiety come first and then the sleep disturbance, or does sleep disturbance? It becomes a cycle. So avoid watching news before you go to bed. Also avoid reading stimulating, exciting materials in bed. So this is where you really want to have easy reading, nothing too stimulating. Avoid paying your bills before bed and even checking your financial reports. Avoid arguments before bed, and really kind of avoid any negative judgment about sleep, that you're unable to sleep, that you have insomnia. That actually will increase your anxiety when you start thinking about how you can't sleep. How are you going to sleep tonight? So do keep that in mind. Now, what can you do? Well, think about using positive self-talk phrases that you can fall asleep, you can relax. There is a reason that people have positive mantras or positive affirmations that they say. They do work. Consider also getting your thoughts out of your head and onto paper. So writing in your journal any thoughts that are kind of in your head that are preventing you from sleeping will help you also process them. So then you can have a better sleep. And then there's also two other things which you may or not be familiar with, but one of them is called yoga nidra. Now, before you tell me you can't do yoga, this is not the kind of yoga you're thinking about. This is actually a type of yoga which is almost a cross between being awake and sleep. So it's like a middle state of consciousness where you're being guided into a relaxation state with different parts of your body. So if you were to go to practice yoga nidra, you can go to a video online, type in yoga nidra, and they're like 45-minute videos that will guide you through this progressive relaxation of your body to help you sleep. Another thing to consider is to do breathing. So one of the breathing exercises that I like to do is alternate nostril breathing. And this is not something that takes that long. It's just a few minutes. You can try that. You can also try the 4-7-8 breath, which you can do under a minute. So there's a number of techniques that you can do to help. Now, do realize when you're doing these, what you're doing is really getting your body into a parasympathetic state. And if you remember when I said sleep is the ultimate parasympathetic state, so they go hand in hand. Now, how can you plan for your sleep? Well, plan to put sleep in your schedule. Clock it in, all right? You are sleeping from 10 o'clock to 6 o'clock or 11 o'clock to 7 o'clock. Try and also go to sleep and wake up at the same time every day. This is what's going to train that biological clock. You can begin prepping for bedtime about 30 minutes before getting into bed. Avoid those late afternoon or evening naps. Also avoid napping for more than 45 minutes unless you're really sleep deprived or you're dealing with a sickness or illness. Consider avoiding large meals or spicy foods before bed. Try and stop eating about 3 hours prior to going to sleep, because what happens is when we go to sleep on a full stomach, our body's a little confused. It doesn't know, should we be digesting the food right now or should we be sleeping? So trying to limit that can be helpful. Also, I know a number of patients who tell me they wake up in the middle of the night to go to the bathroom. Well, you also want to avoid drinking a lot of fluid closer to bedtime. So if you're trying to get in your water or your fluids, try to get them before dinner time and throughout the day. Actually, your body will be able to utilize them more if you do them continuously throughout the day than all at one shot. Also, taking a aromatherapy salt bath can be really helpful. And that warm bath or even a hot shower actually raises your body temperature before sleep to actually induce a sleep state. So there is a nighttime bath ritual you can consider. Super easy to do. 1 to 2 cups of Epsom salts, and that's really to be absorbed in the skin and to relax the body. You can add some baking soda to it to alkalize the stressed out body, and then even lavender oil will help lower your stress levels as an essential oil. So that's a super easy one. You probably have quite a bit of these ingredients already in your house. And then what do we do if we have trouble falling asleep or staying asleep? Well, so here's the thing. If you're in bed and it's taking you longer than 20 to 30 minutes to fall asleep, leave the bedroom, okay? The bed is essentially for 2 things, for sleep and for sex. So if you're taking too long to fall asleep, leave your bedroom, go to another relaxing part of your house, do a relaxation technique, maybe one of those breathing techniques. Consider reading. Make sure you have kind of that low light setting, not the bright TV blue light, or if you're reading from a Kindle or something, you can do the setting where it's a lower light for the brightness. And if you're somebody who wakes up because of light, like light comes in and you're waking up, consider even an eye mask or even curtains that keep out the light until your body naturally awakens. And once again, if you awaken early because of recurrent thoughts, keep that journal by that bedside. I mean, write it down and then go back to sleep. You know, it actually is quite helpful. Now, when we're thinking about our environment and how do we set up our bedroom to be most optimal for sleep? Consider turning down the light in the bathroom and in the bedroom about 15 minutes before going to bed. So if you do need a night light, maybe put it in the bathroom where there's a little bit of a low light. You can also use dimmers in your house. Consider amber glasses before bedtime to reduce that light exposure. As I already mentioned, dark window shades or eye mask. And then if you're an individual who's sensitive to noise and you live in an environment where, you know, there's police sirens and all this stuff, consider closing the windows, using earplugs, or even using a white noise generator. Also look around. Do you have appliances that are kind of ticking away or buzzing that might be interrupting your sleep? Look at the temperature of your room. You don't want it to be too hot or too cold. One of the things that we are all pretty guilty of is sleeping near electromagnetic fields. Now, for some people, it does not bother them, but for some, they can be super sensitive to this. And when you're trying to deal with sleep issues, you really want to create the best environment possible. So putting that cell phone away, and if you have an alarm clock, putting it at the other side of the room, keeping those electronics as far away from your body as possible. And if you sleep with an electrical blanket or something that warms your bed, use it to warm up the bed. And then once you get into the bed, turn it off because that's still an electrical current. Also consider, take a look at the pillows you're using. Try and use hypoallergenic pillows if you're sensitive to that. There's a number of really good sleep pillows and body pillows that can really help you align your body so you can have better breathing and you can have less pain, like especially if you experience arm and shoulder pain, whether it's from your sarcoidosis or from other comorbidities. Having these pillows can really be supportive. Consider sleeping on the highest quality bed linens that you can afford. So when it comes to supplements, now here's my little disclaimer. Do not go out and buy these, first of all, until you work with your own physician, okay? But these are ones that you may want to talk with your physician about and see if they may be beneficial once you have, you know, all your medications checked, all your other sleep factors checked. Melatonin, as you've heard, so our body naturally produces melatonin, but some people could use a little bit more. So 1 to 5 milligrams can help to fall asleep, and then 5 to 20 can help to stay asleep. So this is why I recommend to people, don't just go buy an over-the-counter melatonin. You really want to look at what aspect of sleep is being impaired, so you're getting the therapeutic dosage to address that. Other things to look at are 5-HTP and taurine. And then a big one is magnesium. So even though they say 200 to 400 milligrams of magnesium for sleep, I actually test my patients for their requirements and their levels of magnesium. And I find that many people actually need a lot more than this. So they might tell me that they've been taking magnesium and it doesn't work. Well, when I test it and I see that they actually need 800 milligrams, there's no wonder it doesn't work because their body has a different requirement. Then also we want to consider some other things. Like things that can lower our cortisol or stress hormone levels. And those might be things like ashwagandha, which is an Ayurvedic herb, L-theanine, or other calming herbs. Tea is a very good habit to have in the evening. Now, when you're saying tea, you're like, you just told me not to have caffeine. Well, no, specific teas. So these are things like lemon balm and passionflower. These are decaffeinated teas, and there's specific ingredients that I will show you that will help with that sleep onset. And then another thing to consider is light therapy. So this can be really helpful in the winter and especially in the north. So in the winter, when you wake up to go to work, it's still dark. So your body doesn't really know what is going on. So consider having light exposure first thing in the morning. A lot easier to do when it's summertime. So getting that half hour of exposure first thing in the morning. But in the winter, a 10,000 lux bright light box can be really helpful. So, and then are there any foods that can be helpful for sleep? Nuts such as almonds, walnuts, pistachios, and cashews can be considered good for sleep. And the reason being that they actually contain essential minerals like magnesium and zinc, which are important for sleep processes. One food that they have studied that is beneficial is tart cherry juice. And so when cherries are in season, grab them. But when they're not in season, you can get tart cherry juice or even frozen organic cherries. And the sleep effects of cherries is due to the high amounts of melatonin. And the study that they did was that, so adults with insomnia drank 8 ounces of tart cherry juice twice a day for 2 weeks, and they slept 84 minutes longer and had better sleep quality compared to when they didn't drink the juice. So to me, that's one of those non-medicinal, but yet beneficial things that can really help. Even though it was a small study, there is benefit there. So as long as you don't have any allergies towards it, it's something to look at. Now, I did mention those teas. So I am a big fan of tea. One of them being chamomile. So why does chamomile tea work? Well, chamomile, first of all, contains flavones, and flavones are a class of antioxidants that reduce inflammation. When you think of sarcoid, we're thinking inflammation, right? So not only is the chamomile tea going to help with the sleep, it's also going to help with your sarcoid. Now, there is some evidence that drinking chamomile tea can boost your immune system, reduce anxiety and depression, and improve your skin health. Plus, there is some unique properties that improve the sleep quality. It contains an antioxidant called apigenin that binds to certain receptors in your brain to promote sleepiness and reduce insomnia. Another study found that women who drank chamomile tea for 2 weeks reported improved sleep quality compared to non-drinkers. So now I've already given you tart cherry juice, chamomile. So before you go buying that melatonin, let's try these things and also eliminate all the other factors that we possibly can. And then those who drank chamomile tea also had fewer symptoms of depression, which is, as you know, commonly associated with sleep problems. Now, if you don't like chamomile tea, you can consider passionflower tea. Passionflower tea also has these flavonoids that reduce inflammation, boost immune health, and reduce heart disease risk. This has also been studied, the passionflower, to reduce anxiety. Passionflower also has that same apigenin that I had mentioned to calm the brain and bind to those receptors. There is also some evidence that passionflower increases the brain chemical called GABA. And GABA is something that works to inhibit the brain chemicals that make stress. So GABA is something we actually want. Then also the study that was done around passionflower tea was that 41 adults drank a cup of passionflower tea before bed, and they rated their sleep quality significantly better when they drank the tea compared to when they didn't drink the tea. Very short study, only 7 days with a small amount of people, but I don't see any harm in this, trying this. Then the third one is lemon balm. So historically, lemon balm has been used as an antiviral and antibacterial medicine to treat infections and viruses. It also has the potential to help restless sleepers. So if you're more of the person who can fall asleep, but then you get restless, this might be the type of tea that you want to try. It can also help with reducing anxiety and depression. And so there was a study that was done comparing lemon balm to traditional antidepressants, and the participants who took lemon balm, and not in the tea form, but actually took a herbal of lemon balm, improved qualities of life scores compared to those who did not. So, but a lemon balm tea can also be helpful if you're struggling with that restlessness and anxiety before bed. Before you even get to the supplements, it might be worth looking at. Now, just like your bedtime routine is important, so is your morning routine. Think of it as just as important, because you want to wake in the day as mindfully and with purpose and intention as much as you can. You want to awaken and slowly explore your breath, even consider a breathing practice in the morning. And then of course, that 20 minutes of light exposure in the morning, even if it means that you're waking up, making your coffee, and you're sitting on your balcony or on your front porch with that cup of coffee. Get that light coming in, that natural sunlight. That day, it sends signals to your brain to tell your body that increase your natural cortisol that you need when you wake, okay, and slow down on that melatonin, which you want during the nighttime. So there's processes, biochemical processes going on there. Now, I did have to put this in because there's a lot of mistaken beliefs about sleep, right? So Dr. Ruben Nyman is a physician who's actually a sleep and dream expert. So his books are worth taking a look at, but so he has these 10 myths that he talks about, or mistaken beliefs. And the reason I put this in here is because the thought of sleep and how you approach sleep should not stress you out. So when the myth is that we should sleep at least 8 hours every night. No, your body is personal, and what you need to see is how you function best. How do you feel more refreshed? How are you able to function throughout the day to figure out what your ideal sleep is? The next myth is ideal to always sleep through the night. Not everybody does sleep through the night. In fact, waking through the night can be normal. Then there's also a myth that you have to make yourself sleep. In all honesty, we can't control the process of falling asleep, okay? We can set ourselves up to sleep as well as possible, but at the end of the day, we can't control everything. As I've already mentioned, you should not stay. So people think they should stay in bed and rest even if you can't sleep. So no, okay? So get out of bed, keep your bed for sleep and sex. Another thing that stresses some people out is they think that if I have a terrible day, I'll have a terrible next day if I don't sleep well. And that's not necessarily true. Our bodies are actually very resilient. They can adapt, but you do need to know your body. And I think that self-awareness practice and really getting in tune with what your body needs and working from that place will help you make improvements little by little. Also, good sleepers fall asleep quickly. Nope, that is not true. So those patients that tell me they fall asleep as soon as they put their head on their pillow, that does not necessarily mean that you're a good sleeper. That means possibly you're overtired. So it is normal to take up to 20 minutes to fall asleep. Another myth is that good sleepers don't dream. Well, dreaming is an essential part of good sleep. Now, you might not remember your dreams, and that's perfectly okay. But if you remember that stage 4 of sleep is mainly when we dream. So if you're having good sleep, you're going through all those stages. The other thing is it's best to get up and be productive if I can't sleep. No, so you don't want to be productive. You want to do activities that are going to get you into that parasympathetic state. So this is not the time to get up and go do the dishes or start cleaning the house. This is the time to do relaxing activities, whatever might have you relax, whether that's maybe knitting, whether that's like listening to an audiobook, writing in your journal. Think about that. It's normal to sleep less as we age. This is true that our sleep decreases as it ages, but it's not necessarily inevitable or healthy or normal. So that is a very personalized thing. And that's why, once again, I get you back to, you got to know your body. And then the last thing is, it's comforting to check the time when sleepless. Now, watching that clock actually just makes that night even worse. So actually, I got rid of my alarm clock, I think 6 years ago. So I don't even have an alarm clock. And then I did want to give you some additional sleep health resources. So one of these is called the Insight Timer app. So this is an app you can put on your phone, and it has a number of sleep meditations, some talks and music tracks that will help calm the mind, relax the body, and prepare for sleep. Another thing is that if you really want to geek out on the science of sleep and where your specific body is, using sleep trackers can be very beneficial. I use something called an Aura ring, and it has been really informative to me to plan my days. And it also gives me the leeway when it tells me that my body needs rest, so I don't have to push myself as much. And then I've already mentioned Dr. Ruben Nyman, so you can check out his work at his website. The American Academy of Sleep and the National Sleep Foundation are other locations where you can get more resources. So for tonight, I want to leave you with final words of sleep well and be well. If we could all sleep like puppies, that would be amazing. And you can always locate me at drbhanote.com. On social media, I'm at Dr. Bhanote on Instagram, and on Facebook, I am Dr. Bhanote. So super easy to find, and I'm looking forward to our Q&A. So I am going to stop my share here. So, hello. Hi, Irina.
Thank you, Dr. Bhanote. This was wonderful. I've learned a lot of new things. I've learned that some of the things that I've been doing, I'm from former Soviet Union, and we were very big on holistic medicine. So chamomile tea is like, it's for everything. I don't think there's a disease within former Soviet Union that is not good for chamomile tea. There was actually a question that somebody asked, can they do chamomile tea and with the 10 milligrams of Prozac that hopefully is prescribed and somebody is taking for for anxiety or depression. But I think I know the answer, but I would like to hear your thought on it.
So can you tell me the question again? Can they have their Prozac?
Can I take chamomile tea with 10 milligrams of Prozac? And I think maybe I'm paraphrasing, but somebody is taking Prozac. So maybe the question is it okay to drink tea?
In addition to it?
In addition to it.
Okay, yeah. So yes, in addition to it, chamomile tea can help you. Now, I almost question, is your Prozac working or not? And in reality, just so people, I know that there's a lot of, it's easy to get an anti-anxiety medication, but over time, those anti-anxiety medications you will require higher dosages of them because they will stop working, and ultimately they will totally stop working. So really, setting up your sleep and your anxiety and all these rituals is going to have longer long-term benefits for you. I don't know if there's any interaction between taking it at the same exact time. I couldn't say.
Yeah, and I don't think there's probably any studies that looked at it. So, just like we eat and drink with our medications, unless it's something that we are aware of. I also want to say that we were huge on tart cherries, and I love tart cherries a lot more than sweet cherries. So once I heard that, I don't have problem with sleep, but that would be great for my mom who has trouble sleeping, but she loves cherries, so that's great. And the question was, are frozen cherries just as effective as fresh cherries?
Yeah, so here's the thing. It's the ingredients that are in the tart cherries. So tart cherry juice is what they actually did the studies on. But if you like organic frozen cherries and that you have access to, that's still going to benefit you. My only concern with frozen at night is that having something that cold on the body can have not the best effect. Like if you remember, I said warm bath, and people have thought of having warm milk with crushed almonds in it. So it's that body temperature that you want to raise so you can induce sleep. So having like a frozen smoothie of cherries probably wouldn't be my choice, but a warm cherry, yeah, I think somebody said warm cherries or thaw them. Yes, that's a much better choice.
Yeah. And I can just say, because I love cherries so much, and when they're in season, I buy them in like huge buckets, and then I freeze them and I use them throughout the year. I actually love them in my tea. And I don't like, it's not a tea, but I just take frozen cherries with boiling hot water, and cherries provide that, cherry juice, and it makes like a very wonderful, I call it a tea, but you can call it whatever, warm juice maybe.
That's a good idea. I actually make cherry kombucha. So I'll make kombucha with frozen cherries, and because as you know, kombucha is good for gut health, but yeah, so yeah, cherries can come in handy, and probably underutilized and should be utilized more.
Yeah. So maybe for one of your cooking classes, we'll be able to do cherries and yogurt, warm things at night, as somebody suggested. There was not a question, but a comment that somebody who lives in, I believe, upstate New York, there's very little sun, and you touched on a light therapy. So maybe you can go over a little bit about that, and maybe where people can find it, the light therapy?
Absolutely. So that's what I was saying, like in the north, we in the winter time we have less amount of light, and we really want that bright light in the morning. So you can actually get light boxes on Amazon for quite reasonable prices. There's even ones that are kind of portable that are handheld, or you put it at your office desk or wherever you are in the morning, or maybe even when you're getting ready for work in the morning for that few 10 to 20 minutes. And the thing you want to look for is a 10,000 lux, so specific units for the light box. So that will be helpful. Wonderful.
There were a few comments about people loving baking soda in bath. So that's great. And there was one I wanted to ask you, trying to find, I'm sorry. Somebody said, and few people kind of say yes to, is that the meditation relaxation tapes don't work when you have anxiety. And it's true. They don't work if you are very anxious and you are, you turning it on with that notion of that's not going to work. For myself, I can just share a personal experience. I was in all day meetings today with 10 minutes breaks in between each meeting, starting from 10 until 4, with many presentations. And I was pretty stressed out and anxious. And I listened to meditation. It was 5 minutes because I have 10, so 5 I can afford. And initially it was so hard for me to even focus on the words, trying. And I'm like, that's not going to work. That's not going to work, because I keep thinking I don't have time. And then I had to remind myself that I picked 5 minutes meditation for the reason that it is 5 minutes and I do have it. And I worked on myself to allow myself to just relax and be in that moment. And I can tell you that it helped me, maybe not tremendously, but it totally took the edge off. So my personal suggestion to everybody is, if you're going into anything knowing that that's not going to work, well, you're probably correct, and it's not going to work. And having that curiosity and maybe say, I know that it didn't work a few times before, but I'm really open to trying it again. I want this to work. That usually, helps me and, a lot of people that I work with and talk to. But Dr. Bhanote, what is your
Yeah, so
maybe
no,
suggestion?
you have a great point there. And, I want to bring that point back into the perspective of sarcoidosis, because if you think that my treatment is not going to work or my body is not going to work, our mind is very powerful. And when we start thinking these things and we start repeating these things about how we can't do this or our body can't do this, we are actually strengthening I'm a science geek. I'm going to go back to it. We're strengthening the neuronal synapses or the brain cells to remember that again and again. So when something stressful comes up, we jump to that. Whereas when we go into this practice of meditation, and I'm not saying meditation is going to work for everybody. Sometimes you might need to do breathing, but there are so many different techniques, and you kind of got to figure out the one for you. So the ones people who can't sit quietly, sometimes I will do progressive muscle relaxation, because their muscles are so tight that we work through the different parts of the body with the muscles. And I think last year we did emotional freedom technique of tapping to show you how you can release these energies and stuff. So there's many, many different things, and you kind of just got to try them, and then don't give up because one didn't work, because you will find one that works for you, and then you practice it. So just like when you were in school and you learned how to play baseball and you wanted to hit that, that ball out to left field and you couldn't do it at first, you didn't just throw down the bat and say, I'm never picking this up again. You went back and you practiced and then you got it. So just like that, these other things that we want to do for our life are these kinds of things we have to teach our body them. So
yeah, I agree. And it just like, why does placebo work? Because somebody believes in it to work. So it's, just not changing your mentality, but, being a little bit more curious and a little bit more flexible and open to possibilities. And I'm very auditory. So I go on YouTube and I type whatever meditation I want. This, like if I want meditation for relaxation or for peacefulness or for good luck or, for whatever. And there's always hundreds. And sometimes I just click on it. Oh, I don't like the voice. This is not going to work for me, until I find something that I think may work. And then I try to go into it. So I encourage everybody to, whatever doesn't work, make that motivate you. Don't feel defeated because it's just one thing that didn't work. There's hundreds of others that may work and will work. So that's wonderful. Somebody said the tapping solution app. I'm not sure.
So the tapping solution app is the app that I previously recommended for the emotional freedom technique that we were teaching. So
yeah. Wonderful. Yeah. Oh my gosh, I want to tell you the time flew by so fast. I know we had multiple questions that were emailed to us, but I know you hit on a lot of them during your presentation. And I just recognized that we are 4 minutes over time and people stayed, which is amazing. So I want to thank you again for coming, for bringing us this wonderful information. It is 8:00 p.m. Eastern Standard Time, so soon bedtime for everybody. Please, do what Dr. Bhanote said, put your phones away and try to relax. And I want to also say that not that I agree with you, but I'm doing what you said is I recognize years ago, maybe 3 or 4 years ago, way before pandemic, that watching TV early in the morning, like news, or late in the evening, and I'm not an anxious person, but it increased my anxiety by 100%. So I consciously made a choice to not. And so I don't watch the news in the morning at all. And in the evening, I try to always watch like a little comedy or something to put a smile on my face right before I go to sleep. So I encourage you to try it. And don't be.
Being intentional about how you're living your life and how you're taking care of yourself. So I did see a few other questions in there. So I just want to briefly say, yes, go have that cup of chamomile tea or the passion flower, whichever tea you like. Somebody had asked how much liquid before bed. So, you know, that 1 cup of tea is going to be okay, you know, if you're having it at like 8 o'clock at night. But if you're having your 2 liters of water right before bed, there would be no surprise that you'd be waking up to go to the bathroom. So, and if you do find that, you can always shift it a little bit earlier, you know, to when you're going to have that chamomile tea. So just
and learn, explore your body and trust your body and whatever works for you. Some people, you know, when you were saying, I think I'm a very fast metabolizer of caffeine because I can have double espresso and then go right into sleep with no problems. But I know that if I had a problem with it, I wouldn't be able to do it. And my mom knows it. And she said her last time is like 2:00 p.m. for coffee. Otherwise, she wouldn't be able to sleep. So listen to your body, learn, and then work with it.
Yeah, listen to your body. That is great advice. Really explore your body. And I think one of the things I did, you know, I really want to answer these questions for people. So one of the ones that was written in was about pain. And pain is also a very complex thing of chemical reactions happening in our body, that it's releasing all these chemicals that are actually causing pain. So realizing that and understanding that, you know, some things are out of our control. So that's why I always say to people, control what you can. You can decide that you're not going to watch the news, right? You can't decide some other things, but the things that you can decide, you can decide if you're going to eat a plate of nachos 10 o'clock at night, or if you're not, you know. So be intentional with the things that you actually have control over. Never give those things up. That is, you don't have to. I mean, there's just so much that you can do.
Agreed. Well, thank you again and again. Thank you everybody for your very thoughtful questions, for your kind feedback. Dr. Bhanote, you got a lot of great thank yous, and people love the information. We can't wait to see you soon, and please be tuned to our next speaker series coming up very soon. Thank you and good night, everybody.